Welcome to the Vocal Dental Nurses with your hosts, Kate and Shelley.
In the technical department on his little wheel. Well, good morning, Shelley. How are you doing?
I'm very well, thank you. Happy New Year.
My goodness, it is Happy New Year. Crikey, the last time we did one of these was in 2021. Can you believe it?
Yeah, it soon goes, doesn't it? With all the Christmas chaos and that, it's just, trying to find the time to come together again, isn't it?
I know. But we're back with a vengeance. So here we are. So how's life with you? You busy?
Very good. Always busy. I'm never not busy. It's, it's always busy. It's, but that's how we like it. That's how we,
100%. Well, can you believe that, we're knocking on the door for being 2 years before all this COVID malarkey started. Can you believe it?
Yeah, it almost feels like we've lived with it forever. But on the other hand, it almost feels like it sort of only started a couple of months ago. It's a real strange, strange times, isn't it?
Yeah, I know what you mean. And do you know what? It really has become second nature. So obviously this time of year, much like you, I would imagine, when you're getting kiddies sorted in the morning for school, have you got your lunch? Have you got your hat? Have you got your glove, your scarf? Have you got your mask?
Yeah.
And it's that thing now. It's become part of us with masks and all the other stuff that we have to do, hand sanitizer even more so. And
yeah, they've got their own little individual bottles clipped to their school bags, bless them.
Yes. Do you know what? It was really strange, actually, because I'm trying to think when it was. Last week, one of our kiddywinks is in secondary school and the other two are in just about to go in there. But I had two separate emails from obviously two separate schools on the same day. One was to say that my kids were going back into class bubbles. But the other email for the eldest was saying they're actually relaxing the use of face masks in the communal areas. And it was just like,
yeah, no one knows where they are still, do they? It's all, it's all chopping and changing all the time. And
it is. How has your practice sort of fared? 2 years in, everything's second nature to them.
Yeah, but then I've got to be honest and say that unlike a lot of dentists, once we had our full level 3 PPE delivered, we were straight back into surgery. We got the fans to do the air exchanges, and we've worked all the way through. Well, we've had someone on the phone this week to say that they're in agony with toothache, and their dentist still isn't allowing patients through the door. And you just think, how? Why? 2 years on, then they're not seeing patients. And then obviously you've got all this backlash because we're predominantly NHS. Yeah. And you've got all this backlash now of they want, the UDAs up to almost full capacity. But thank goodness for us, we've worked all the way through. Once we got all our gear, we were straight back in surgery. Yes, okay, we had to do the fallow periods and all that sort of stuff for a long time. But yeah, we've tried to keep it as normal as possible, not just for the patients, but for the staff as well, because who wants to go to work and refuse to see patients all day? It's just no.
Well, it's not what we're there for.
It's not right, is it?
I wonder how, with these practices that, as you've just said, that aren't seeing patients or limited, I wonder how the staff feel, because with this length of time not getting back to operating, I don't like to say properly or fully, but you know what I mean. Yeah. I wonder if it makes them more anxious to return because of the gap. Do you know what I mean?
I would have thought so, definitely. I know when we all were asked to go back in once we'd been, fit tested for our masks and once we'd got all that sort of stuff in place. We'd only been out of it for a couple of months and there was some severe anxiety going around with, with the practice as a whole. Okay, yeah, a couple sort of brushed it off and like, oh, whatever, let's get back in there. But yeah, so I think after 2 years,
crikey, yeah,
I think you would be quite nervous because I suppose then you're almost being, what's the word? Institutionalized, aren't you? Yes. In a way.
Yes. Yeah, that's a brilliant analogy, actually. Very much so. Very much so. Crikey, stepping foot back in there, or even if they're in there, like I said, not operating fully. I mean, crikey, what a shock it will be if and when they do return. I mean, how is, you'd think, how is the practice running?
Yeah, and this is the thing. I mean, once we were back up and running, yes, we didn't see checkups. Yes, we didn't have a hygienist for a long, long time. We were literally just manning the phones, and anybody with toothache or broken fillings, anybody that needed to be seen sort of urgently, they were seen. I can't remember exactly when we started seeing the checkups and that again, but it was as soon as we physically could, because we were all just desperate to have some normality back. And also as a team, not to have that backlog of patients, because to have that hanging over you would be, I'd imagine, a very stressful,
Yeah.
Because the public want to know what's going on, and if they're calling you up asking you what's it's just going to make them more anxious knowing that you're still not working properly.
Of course it is. And to be fair, I remember you guys when we came in, I can remember you telling us that you were working your way through the routine appointments, that being the examinations, and I've got to say you were a lot quicker than some of the practices we're in, and that's not wrong or right, because obviously it's got to be when you're comfortable, but you guys were very on the ball, very quick, weren't you?
Yeah, definitely we were. And it's because I think for us there was, once we'd had the full level PPE, and then of course we were offered our vaccines very early on, being NHS, so most of us took those up. So it was a case of there's no excuse really. People need to be seen. They need to, and if you're not in surgery doing your checkups, what are you going to come back to when you do start doing your checkups? How many caries and perio problems are you going to open the floodgates to? It's just there's been no maintenance, has there?
No
prevention, no preventative care, should we say?
Yeah, no, 100%. I'm with you there, Shelley. And the thing is, what they will find, which is exactly what you just started this conversation with, is that patients will vote with their feet, because I would imagine that patient that potentially called you yesterday or whenever as an emergency, will stay with you as a patient. And, this is what we hear with the practices, that those that were still taking on patients, the patients that couldn't get into their own dentist, needed to be seen and have sought dentists elsewhere. So those practices that haven't opened fully, not only, as you've said, will be tackling, firefighting, all the work, the backlog, they'll also realise they've probably got to drop off in their list. Yeah,
and that's the thing. I think if you've got toothache, your loyalty, there's no such thing as loyalty. You will, if you've got toothache, you'll see anybody, won't you? It's one of the most horrendous pains in the world. So yeah, I think to be told by your own dentist that potentially you've been with for many, many years, oh sorry, we can't see you. Yeah. And it just make me wonder, what excuse are people giving to not have patients now enter the surgery, or to not be carrying out AGPs now that we're,
I don't know, because
I don't know.
A lot of patients now, whereas before AGP to them didn't mean anything, it was probably another dental term. You know what it's like when some patients come in and they laugh at the jargon that we use. Yeah. AGP was just initials and things they didn't know, but they're fully aware of what that is now.
Oh, definitely, yeah.
That much covered in the press about AGPs, and if they've asked, obviously we've said, so they're very clued up.
Yeah.
So they're not quite as less informed as they were before. So yeah, I do believe a lot of them will be asking questions themselves. And unfortunately, there's one of the practices you know very well. Bless them, they're still getting quite a bit of grief on the phone from patients, and I just think, it is difficult, because as you know, the one I'm on about is fully up and running as well.
Yeah.
So it's very, very difficult. And of course, then you come to the other end of the spectrum for patients that haven't been regular attenders but are on the dentist's or the dental practice list, and you've got to try and look after them as well. But then you've got your loyal, regular followers that who do you turn to?
Yeah, it's been difficult. We've sort of tried to, because we're so busy and we don't tolerate FTAs very well. we've tried to speak to as many patients as we can to ensure, well, to reassure them really that just because they haven't been in for the last, 2 years, their place still remains, because you've still got to be aware that a lot of people, especially if they don't need to, they don't want to come out to the dentist. Why would they? That some people are genuinely scared and feel that dental practices aren't the safest places to be, especially if they don't need to be there. So there has to be a bit of leeway with that as well, I think, at the moment. With
100%. Got to be mindful, haven't you?
Yeah, that's it. Mindful of people's, fears, and because if in lockdown you were sat at home watching the news all day every day, it's been really quite intimidating, and it's been scary. It's been a horrible time.
Very much so. We saw somebody just before Christmas, who we've seen for a couple of years, very, very confident, older lady, very, very nice, very chatty, very lovely, came in with her husband a few times, had some work with us. And the husband contacted us and had a chat with us and explained that his wife needed to come in, but she hadn't been out since the beginning of COVID.
Yeah.
That was just before Christmas. Shelley, when we saw her, she was a shadow of her former
self. Yeah,
she didn't want to take her mask off, and the obvious when you're coming into the dentist. Didn't want to take her gloves off. Wouldn't accept a fresh mask. And when I say wouldn't, I don't mean that in a horrible way. She was petrified. She was very upset. Very upset. Hadn't been out in your own house for that amount of time. It's terrible. Absolutely terrible.
It's no life to lead, is it? It's just
no, 100%. And what about the vaccines with nurses? We've come across another lovely nurse who doesn't want to have the vaccine but does want to remain in the practice, and obviously, as we know, the deadline's fast approaching. It's
very fast approaching, and then I feel a bit bad because obviously the weekend just gone, there was lots of talk about them possibly delaying the vaccine or postponing it for 6 months, which I know just from being on the dental nurse forums and from two of the lovely girls that we work with that aren't keen to get it, it sort of really gave them hope. They honestly believed that potentially it was going to be delayed. And then, of course, yesterday they've said, no, he's going to push it through. He's definitely going ahead with it. Oh, it's just, I think it's just going to be a really traumatic time the next few weeks, the next couple of months.
Very much so, very much so. And as we've echoed before, Shelley, what we're going to lose within the teams are some absolutely fantastic nurses.
100%, absolutely 100, and dentists and receptionists, and you could go on, and hygienists and therapists and orthodontists. He's opening up a whole can of worms. I'm not going to get too political with it because I don't understand it all fully. I don't know. It's going to be a very turbulent year ahead, I think.
I think you're right. I think you're right on many levels. And as I say, the dental profession will lose a lot of good people, as you say, albeit nurses, receptionists, hygienists, dentists, and it's a shame. So let's watch this space. And I think on that note, we shall leave it there, lovely lady.
That's fine, yes.
Lovely to speak to you as always.
And you, yes, and you.
As Shelley and I say, anybody out there, if they want to come and join the panel, just want to have a chit chat to the fat, then we would love to have you on the panel, wouldn't we?
Absolutely, definitely.
Just contact either one of us, Shelley at the Bewdley Dental Practice or me, Kate at HortonImplants.com. Fantastic. Have a good week.
Thank you. You too.
Take care. Bye.
Bye.